Dr. Shepherd. This is A Survivor's Life. Thank you so much for coming on to the show. We really do appreciate you, and your time is valuable. We know that.
All right, so I am Dr. Vanessa Levine Banks Shepherd. That Levine, I didn't always like it, but that's my great grandmother's first name. So I
Oh,
use it now. And I currently work at the Massey Comprehensive Cancer Center. So I do cancer research and I focus in on really individuals, groups that bear a disproportionate burden of breast cancer. That's been my mission and my focus for the last, I don't know, almost 2 decades. So that's kind of who I am during the day. I'm also a mom, a wife, a daughter, sister, community member, and I work to try to live holistically by integrating all these different things that we are as women.
thank you so much, Dr. Shepherd. I mean, well, you have an amazing resume. That's the reason why I kind of reached out to you because I was just, seeing you on Instagram and, what you do and what your title was. And I was like, she would definitely be of assistance to provide us some education, especially in the cancer community.
Sure.
And so if we can just do a little bit, let me introduce myself to you guys because we're brand new here. So an introduction, I am Kimberly Wyatt. Kimberly Survivor Wyatt online. I'm a two-time breast cancer survivor. So I educate and I mentor and advocate for patients in active treatment. I'm the founder of the nonprofit organization Second to None Cancer Foundation. I created a bag with all of the items that I've used while I was in active treatment. I also have a breast cancer clothing line. It's called Au revoir Clothing and Apparel, where I created a necklace and, I have some support clothing as well. And, those are available for purchase. But those are what I do.
That's outstanding. And it's so important because we need organizations to walk with women for sure. I appreciate you talking about the things that you needed during treatment and during active treatment specifically. A lot
Mhm.
of my research really focuses on the point after diagnosis
Yes.
and trying to figure out how do we improve overall quality of life for women.
Mhm.
How do we make sure fewer women have a recurrence from breast cancer and then ultimately survive and thrive? And we've been expanding to also consider more about the family unit. And, I'm sure as we talk, I'll share more about why breast cancer, why that work. And then there is this interplay between what I see in science, what I see in research, and then also from the community as well.
Yes, definitely. So, as far as since you touched on the community, I know factually just being out in the community and talking to different people out there, and even myself when before I even got diagnosed, I knew about cancer, but I didn't know what cancer really was and how it was affecting people, especially women of people of color in our community. What types of things do you do or say to someone that doesn't know anything about cancer if they have a family member that just was diagnosed? What types of things would you walk them through and, how to be of help to their loved one?
Sure. So because I work in cancer, sometimes my friends say, "Can you stop talking about cancer?" Um, because we live and we think about it every day, right?
Yes.
But not just from a research perspective, but the people. And I'm often reminded that while I'm in this, cancer bubble, cancer center, cancer, that's not people's everyday experience. So
Right.
there've been people in my life of even services, I'd say this last year, who I'm maybe paying for a service from, and we start talking. A lot of time it's about cancer prevention, right? A
Mm-hmm.
lot of times it's about sort of lifestyle, so we ease that in. So I work to sort of spread both the good news that people survive cancer right now. 36% lower rates of people sort of surviving from cancer than they did maybe 20 years ago. So we are seeing improvements. And there's some things that we can do to mitigate it. So I talk to people about that. when diagnosed, for example, there was someone getting a service from early in the year, and we're just talking, and I'm like, okay, it sounds like she's going through cancer, and so the person was getting a diagnosis,
Mm,
needed to find had surgery, but actually needed chemotherapy.
mm,
So as I'm listening, I'm not hearing the person say the word oncologist. And so we are talking. I'm like, well, seems to me you need to have chemotherapy. Have you seen an oncologist? And it's like and the person sort of said the word again, like, unfamiliar with oncology, because we use all this terminology, chemo, different types of medications, but that's not standard language. And so we started a conversation, and I said, based on what I'm hearing you say, I'm pretty sure you will need chemo
yeah.
therapy. And then I said, do you happen to have your pathology report? And the person had things on the phone. And so we looked at it, and so we stopped the service and
Mm,
started talking about, this is what this means, right? This is what margins mean, all these things that you get this report. And I said,
right.
you really need to call, back the surgeon. The surgeon said, oh, I got it all, but did say you needed to see this person, but it wasn't clear that you must
Must
see
see
this
an
person.
oncologist.
Right. And so, and the person went through treatment, is doing well now. The
Good.
thing I learned was the person chose not to tell the family members. So as you talked about your daughters going through that with you, this person did not tell their adult children,
Mm,
did not tell their extended family, told their spouse, but did not tell their extended family. People think that some people feel a stigma if people think that you're sick, and particularly around cancer. Still. So that's just an example in sort of the everyday of interacting with people. So it's living in that space, but always bringing hope. And I try to be an ambassador of hope from my own experience. Like, I'm still here. Look at me, brainstorm
yes.
reasonably, right?
Looking amazing.
And to say, God has blessed me and has given me this opportunity. And to encourage
Amen.
people, like, chemo stinks, chemo sucks, we don't like it, but it kills stuff.
Yes.
Right? And so, and it kills what it needs to kill. And
Hmm.
and then you can get through it. And it's better now, honestly, on people's bodies than it was 20 years ago. Like, for
Right.
real, like, for real, for real.
Yes, I agree.
So, and then it's not going to be easy, right? The
No,
journey is not easy.
it's a
Uh,
long road.
it's a long road. And that's why I really applaud your organization,
Thank you.
walking with people through it. And we collaborate a lot with survivors too on a lot of things that we do.
Good. Walking through with the survivors, you definitely need that support. And so to your friend that did not want to tell their family members, I always get like confused as to why you wouldn't want support. Um, I don't like the stigma as to, kind of looking down on someone because they have cancer, but I think that a lot of the time it's really in their own head. Because are people will embrace you. Like they have so many organizations, they have lots of groups. There's a lot of things out here, and I am, I people knew that I had cancer, and thank God I don't look like what I've been through. But
Yeah.
I went through my second diagnosis during the pandemic, to where I couldn't have anyone there, and I wish that I had someone there, and it was horrible. So I can't imagine that you can have support and you just don't want support. Like that is just I really I'm really baffled by that. But I would say to anyone that's going through cancer or any type of treatment or anything that's traumatic, please, please, please advocate for yourself. Now, Dr. Shepard, as far as the support, would you tell someone that is going through their diagnosis alone? And I know that your friend, did
Sure.
you tell her that she should, reach out to someone, or she at least should talk to her family?
So I did suggest it very strongly, right? Um,
Yeah.
and what I've seen through the years is sometimes family members, most of them want to be supportive. Uh,
Hmm.
sometimes they may not, that you have to teach people to give you the support that you need.
Mm-hmm.
I will say in that particular situation, the person really felt, and it's interesting you have these conversations, right? About, what's going to be is going to be. And I'm a woman of faith and faith in action, and right. And so for me, faith always means doing something, right? And
Yes.
I'll just go from a Christian perspective, right? When Jesus Christ healed, it was like take up your bed, go tell, get
Mm-hmm.
it was an action associated with the healings, right? And so that person felt that in her family, and this person was from a large family, that
Mm.
because of the lack of understanding about cancer,
Wow.
that people were going to add fuel to the fire.
Mm.
One of the things that is important for me is that when someone is diagnosed, that the people around them have an opportunity for education. Early in my life, while in college, I actually had Hodgkin's disease. So I was diagnosed with Hodgkin's.
Wow.
And at that time, it was before the internet. So there wasn't a lot of information, I didn't meet the typical person that would get Hodgkin's, by race and all these different characteristics. And a lot of people were just ignorant to it, right?
Yeah.
People were supportive, but people didn't know, could you catch it? Could you, whatever. And so
Yeah.
I went through quite a journey with two
I'm sure.
relapses and tons of bone
Mm.
marrow transplant. I mean, I went through a lot
Wow.
at a very young age. So by the time she and I are friends because we knew each other as young adults, I'm trying to encourage her that, listen, I have had tons of chemo, right?
Mm-hmm.
Tons and tons
Mm-hmm.
of chemo at a very young age and culminated in a bone marrow transplant, right?
Mm.
So you can get through it. You can get through it. And I was really angry for a long time. I still am a little angry. And it's years later that the community around us, because we were in a similar faith community, and
Okay.
really supported her walking by faith.
Mm.
Having treatment is not the opposite of faith. I don't know why we
Mm.
confuse that, because if you need some money, you go to work. You having faith then. We don't say, I
Right.
have faith, so I'm not going to apply for a job. But when it comes sometimes to certain types of treatment, particularly in the cancer realm, there's this weird sort of paradox that people puts themselves in. And so I did not tell her, I knew that you must do this, right? Because if you have to also be led to know your decision, right? You have to feel like
Right.
it's the right decision. But what I
Right.
did encourage her was, don't think that exercising faith in God, faith in healing is the absence of going to have treatment. The
That's right.
two can go together. They're not
Mm-hmm.
mutually exclusive. They're not at odds with one another.
Mm-hmm.
And I said, and I will respect what you say, what you feel, but there's a thin line between faith and fear.
Right.
Sometimes we're afraid of this thing that's so massive. And she had talked about seeing people die while on treatment, but these are people who were diagnosed later. And so,
Mhm.
um, I talked to the people around her that were really encouraging and cheering the fact that she was foregoing what the doctor told her to do. Uh,
Mm.
and she passed away way too young, way too young,
Mm.
because by the time she decided to have treatment, it spread to her brain, right? And so I was really upset with the health system, because I really felt like, the provider's goals are to do no harm. And sometimes when a patient may seem like they're being non-adherent or non-compliant, it really is because they need more of that, um, maybe mental health care. They need more of that hand holding, more information. They may need a little more of the interpersonal touch,
Mm-hmm. Empathy,
right?
education.
Back
Mm-hmm.
and beyond facts. And then again, having somebody to walk through it with them. And so, so the healthcare system, to me, that was a failure. I feel like the community failed. And so that experience at a younger age, when I wasn't focused on cancer, really birthed that, what, I want to try to help fill these gaps after women are diagnosed. I want to try to understand from a research perspective
Mhm.
And then I said, well, I'll focus on breast cancer since I had Hodgkin's. I'll focus on something I didn't have. And then ha ha ha, 20 some years later, then boom, right? Because the treatment had actually put me at increased risk, right?
Mhm.
Um, and
Yeah,
so and so I'll just kind of say with the advocacy really quickly, one of the ways I feel as if that we help to make things better, healthcare better, is by doing research that matters, but it's also by us being in the research.
that's right.
Okay? Because I should have been in a national trial called the STAR,
Mm,
but I was never approached for it. But I
right.
didn't know really about that I should have been eligible until I'm sitting in an audience, huge audience, and I'm looking at these statistics that are showing that people with Hodgkin's, 50% more likely to get breast cancer, da, da, da,
Mhm.
all these different things, this increased risk or more, or different studies that showed even 3 times this or whatever. And I'm like, oh, wait, how come no one ever talk to me about this? And I go to the doctor. So we
Yeah,
need to know what's out there and what's available to us. um, we need to, I believe, communities engage more in research that is humane, where you can have a voice and be treated well, right? And
Mhm.
there are things out there to monitor the research process,
Mhm.
so that our voices can be there, but also our data, so that as treatments are being developed or processes, that they're being developed with us in mind. And anybody can fill in the us, right?
Yeah.
Regardless of race, ethnicity, um,
Mhm.
that age, right? That we're in these studies.
Yeah. I agree. Your team. Team is
Yes.
important. Team is super important. That oncologist, like Dr. Shepard said, you need an oncologist. You need an oncologist. You need the surgical oncology because he's going to be the one to cut the cancer out. You're also the oncologist is going to help you with your treatment plan as far as your chemotherapy as well as your radiation. And then also, this is something that I did during my cancer diagnosis, and this was me advocating for myself. So the first diagnosis, I just pretty much I was in the cloud and I just let them do whatever they wanted to do. The second diagnosis, I refused to be sick. Like I didn't want to feel sick. So I
Right.
was on a different type of chemotherapy, not the adriamycin cytoxin. I was in Toxil and Taxotere and I think Herceptin. But when I felt myself getting sick, I went to the doctor. You know what he said? Okay, well, we can lower the dosage. It's just going to push it out a little bit further. I said, okay, that's fine if I got to be on here. But guess what? I didn't get sick.
I'm glad you said that, because you do have an opportunity to be in partnership with your.
Mm-hmm.
So you need
Yeah.
to understand why this medication, why this timing. As a young person, when I was having treatment for the recurrence, they would put me in the hospital. Initially, I wasn't, but by the third time, I would have to be in the hospital for chemotherapy. And I
Mm-hmm.
would leave being, I was sick. We didn't have the anti-meds that they have now.
Yeah.
And I was planning my engagement party, and I wanted to
Mm.
look cute and feel cute. And so I'm like, I don't want treatment on this day, Friday, because
Right. You want to
mess
feel cute.
me up. Right. And so he's like, you know what? We can just push it a day or two. Right. And it made the difference. I was able to enjoy the party. Some of the things you talked about, I just wanted to highlight sort of the transition from active treatment to when you're
Mm-hmm.
done. And it is very intense when you're in treatment and then you're done. And it's like, then what? And so I think that's a different type of support you may need.
Mm-hmm.
People around you, like, yes, you made it, you feel great. And then it is a whole new something,
Yeah.
right? It's the thoughts of the what if, it's the now maintenance, it's what I need to do. And so your transition team may look a little different than the support team when you're in active treatment.
Mm-hmm.
And then I wanted to comment about the screening. So we know with breast cancer, there are, mammograms, right?
Yes.
Um, we encourage little girls, young girls to know your breasts in general. So know what feels normal for you,
Mm-hmm.
because they're not going to do routine mammograms on a 25-year-old, right?
Right.
It's important to know your history,
Mm-hmm.
because given a person's history, they may need to talk to a genetic counselor for hereditary breast or ovarian cancer, or they just may need an earlier mammogram, right? So you don't have an alteration in your BRCA genes, your breast cancer genes, but maybe just for the family history that is not associated with any known hereditary marker, but you may need a mammogram, a baseline at a younger age. So that's where the talking about it, the normalizing cancer. And then there are some studies now, and actually we have a study going on now that's looking at a blood-based biomarker for cancers
Mm,
that there are not typical necessarily screenings for. And these would be for people who are, they've not been diagnosed with cancer. And if you participate in the study, the majority of the people are not going to have any type of biomarker. But if you do, then as a study participant, they'll pay for that workup.
mm,
And we had a person on a panel with us recently who did have a cancer that would not have been detected because the screening tools, there's not a machine to look at. It wouldn't have been caught even in an MRI, but at
mm-hmm.
blood level, right? It could be. So there is progress. I know that some people have said to me, I don't want to know, right? But we kind of do want to know. And because our decisions and things that we make can be more informed from everything, decisions you make about your health care, your life care. So as much information as you can gather about yourself, and then I would say, and your family, then you can always just ask. So if you are in active treatment, you've been diagnosed, you can ask what clinical trials are there. And not all clinical trials involve taking a drug or not taking a drug.
Mm-hmm.
Sometimes the clinical trials are about quality of life. We've had clinical trials that have helped people to make decisions about the surgery because sometimes there are maybe two options that are equivocal, meaning that there's not enough evidence 100% to say that this is better than that. And so you could get that plus something else. And we actually have a study now that we're going to probably finish recruitment on. And that study is I call it my baby study because it was really birthed in that example I gave you earlier about the individual who didn't necessarily want chemotherapy. And so it's to walk people through what's chemotherapy, what's hormonal therapy, right? And
Mm-hmm.
so they can understand and they can tell their story and then helping women to understand everything that's important to your decision, right? It may be, you know what, I can't get to the doctor every day. And so
Yeah.
these are the things that your provider team needs to know because many cancer centers have different types of programs to help people with transportation. So sometimes we don't have because we don't ask. And again, not putting all of the burden on the patient because bring your family member with you.
Yes.
Right. And to speak up, as you said, that you have to be your own advocate, but organizations like yours, some of the work that we try to do in the community, both with our cancer center and our research, is to help people partner and have the tools that they need, uh,
Mhm.
and to be prepared in case there is a recurrence. And so from listening to you, so you had ER positive breast cancer, right?
Yes.
Right. And a lot of people are afraid of triple negative breast cancer, right? But people relapse from ER positive too, right?
Yeah.
And so a lot of people, when they think about a certain subtype of cancer, they think about a certain face or race, and that's not true. That's not true. Cancer is a tumor, and
Yep.
sometimes if it can become resistant to drugs, and now we have immunotherapy. So there's so many things that are evolving um, as we try to be more precise with the care. But at the end of the day, no one has all of the answers. And
No
so
one.
that's why the conversations are good. It takes a good medical team. I believe 100% it takes faith because you're going to need that faith when you don't feel well, when you may not
Yep.
have energy, when you may not want to do what you need to do, or you just feel exhausted because you've got to keep showing up at the doctor. And
Right.
a team that's going to push you to say, I know you don't feel good today. Right?
Yep.
You may not want to eat. My best friend, she came to visit me when I had the transplant. And again, this is years ago, and I wasn't married yet, and I wasn't hungry. I wasn't eating. And so she said, "Oh, you're gonna eat." And I'm like, and she like started trying to force feed me. I remember these mashed potatoes, right? Because we do that for each other.
Right.
And we understand right now you may not feel this way. And sometimes we're going to be the strength for you so you can do
Hmm.
what you need to do.
Yes. I love that. I love you. Everyone needs a friend like Dr. Shepherd's friend. I love her for that. You're like, you're gonna eat this food. I love it.
Yeah, she was in my really, she was in my face. She was like, "Oh yeah," when I had the relapse from the Hodgkins, and I'd been through so much chemotherapy, and I used to be very, very sick. I'd gotten down to a size 2, um,
Wow.
because I wouldn't eat for at least a week and a half. Like I just wouldn't eat or drink
Wow.
because I wasn't, it just took my appetite and I didn't like being sick. And so
Mm-hmm.
so I remember telling her, when I got the diagnosis in 2014, which is like 23 years later when I had the diagnosis for breast cancer. Um,
Mm-hmm.
and I'm like, okay, this is what I study, so this feels different. I know what these stats mean differently. And so I
Yes.
did process that very differently than when I was young, first single and single the whole time actually. Then now I'm older. I've lived a little bit of life, right? I've sat with people who aren't here anymore, and also I'm a
Mm-hmm.
mother of young children. So it was very different for me, and I was much more private
Mm-hmm.
because I couldn't take the noise of people comparing maybe what I was experiencing to a statistic again, because now I'm in this field that I study. So I
Mm-hmm.
compartmentalized it, right?
Mm.
Compartmentalize it, but I did have a close group of folks. And so going back to my lifelong best friend, I'm like, I don't know if I'm gonna do treatment. She's like, you're not gonna drink orange juice. You're gonna have treatment if I have to stuff it down you.
That's a good friend.
And she's like, we are not. I know she had a conversation with my mom. Actually, they cried together. But it was just, but with me, she was like, oh, we're not devastated, you
Oh
know,
wow.
and but I had to sit with God in that space to say, okay, I had to hear from him. And
Mm-hmm.
it's like, you will not die but live.
Yes.
Right. And the being here part, it is to help others to live their
That's
best,
right.
is
Yes.
to push the envelope, right? And like you said, maybe when we were first starting, like not looking like what they've been through, because if you read the list, it's like, well, and so that's the connection of the faith and the action.
Mm-hmm.
And, we know that nationally, Black women have a 40% higher death
Yep.
rate from breast cancer compared to their white counterparts.
That's right.
But that wasn't always the case.
Mm.
Okay. And so it wasn't always just a fact that we had this higher death rate.
Mm.
And so what we want to do is to make sure that as the treatments are being improved and refined, that we're having access to those treatments in a
Right.
timely manner, right? We're not waiting, that okay,
Mm-hmm.
that we are being an advocate for ourselves to get diagnosed and to what's my treatment plan, understanding
Mm-hmm.
it, right? And maybe comparing it, because I will tell you, every place may not be the best place, as you mentioned with the oncologist.
Mm-hmm.
Okay. So that's important. And then along the way, being in touch and understanding what's happening with your body, right? And then living our best lives as we can up front. Some things
Yes.
we can reduce the risk of, and some things are going to happen, I would say, rather through us than to us, because it's not meant for you,
Mm-hmm.
someone else. Now, this is happening to you when you're taking like the red devil. I know that devil too. I could get nauseated from looking at it. Um, it's happening to you, but it's not just for you.
Right.
And so we do what we can to reduce our risk. Some things it's just because of the environment. It's because there's not an explanation. But once diagnosed, we want to get the best treatment possible, understand it. Like I said, take advantage of any trials, and then really look around where you're getting your treatment,
Yep.
see what those options are, and compare.
Mm-hmm.
And compare.
Yes. I love that. I love the fact that you said where you're getting your treatment. It is important to your doctors are online. Like you can go and Google your doctor, you can go and find information about your doctor. The doctors have to, be part of the medical board. And so they have scores and all of that. And so you want to see where your doctor is and where your doctor lies as far as their rating, as far as I just went with whatever they told me. Oh, we recommend this person. Okay, I went over there. But so that's because the doctors recommend other doctors, and if they even part of that facility, you can still contact the medical board, find out ratings, find out what is his success rate of surgeries, things like that. Because I made sure that I put information, I contacted the medical board, I put in a complaint, and because I felt horrible, and it went on for at least a year and a half. That and he took no responsibility for it, what he did or what he didn't do, lack thereof. So if you have a surgery and you don't have a drainage tube, you should have a drainage tube, especially if it's a body part that was removed.
Yeah, that's important. And so I think that's where, I mean, you're giving, even some ideas of how, as patients prepare. And so a lot of my personal research is focused more on the systemic therapy, right? Chemo, hormonal therapy, things like that. But the surgery decision is no joke
Yeah.
for people, and it's a lot to it. We have a partner that we work with who got an infection,
Mm,
almost died, not from the cancer, but from the surgery, right? And so to the extent that before you have surgery, what you can hold things in your hand. The American Cancer Society gives great information online. Usually it's acs.org. The
mm-hmm,
National Cancer Institute, I believe that's nci.org,
mm-hmm.
that you can go and put stuff in. It'll tell you about clinical trials. It'll tell you kind of what's the standard expectations, and as much information as you want to go deep dive into, you should do that. I will say that when we have had research studies, we've seen that certain populations go in armed with a lot of information. Sometimes they think they're the expert, right?
Yep.
And some other populations don't. So we now live in an age where most people have a phone. Okay?
Mm-hmm.
Most people have some sort of smartphone.
Yep.
So we can now put things in our hands that we couldn't 25 years ago
Right.
and ask those questions. Another thing I think is good is when you have a testimonial of somebody who's been to that place.
Yep.
Okay. And it's okay to ask, well, do you have any patients that would mind talking to me? And I think going back to your point of support, that's where the support groups happen.
Mm-hmm.
So your organization, wherever people are, type in breast cancer support groups,
Mm-hmm.
right? Because then you may hear from three different people that like, this was a really great place. I didn't like this place. And then sometimes people can help you get from one place to another. So I would say support groups can't be underestimated. And then having in your hand what to expect and what questions to ask, right? So
Yes.
everybody's not going to be in a study. We do coaching with our study participants to help them prepare for treatment. Um, but now I'm at a point where moving beyond the research, we just really need to put more things out there to help people.
Yes.
Because what happened still shouldn't happen.
I
Right?
agree.
You shouldn't have left surgery without a drainage. You shouldn't have been, right. These things shouldn't be happening. And they still happen. There are medical errors that happen, right? Mistakes do happen. So that's why they're
Mm-hmm.
called accidents and mistakes. So they do happen.
Yep.
But there is this, taking accountability is important. But also to the extent
Yep.
that sometimes by asking the question, you actually help somebody remember
Mm-hmm.
they should do.
Yeah, thank God. I thank God for therapy. Thank God for God,
Yes.
because it brought me closer to God. So you do have to go through some things to get to some things. So I went through all of these things, the two diagnoses and everything, but it brought me closer to God. But I also wanted to touch on the fact that if you have any children, I have two daughters. You did touch on early detection. I have two daughters, so they have to get that they have to get their mammograms 10 years prior to my diagnosis date. So I was diagnosed at 36. And so they were 26 when they were starting getting mammograms. And so they get 26 and going forward. I want to say this to people that don't have, any family members or, direct contact. If you feel something on one side, please continue to do those self breast exams. If you feel something on one side and you don't feel it on the other side, go get that checked out and then continue to advocate for yourself. Also, we want to, kind of, if you drink a lot of caffeine, if you eat a lot of chocolate, you want to make sure you kind of limit those things because it is a driver of, density of the breast. So we want to kind of limit those things if you can. I know we all love us a good piece of chocolate. I'm here for the, nice dark chocolate, something or other. But we want to limit things that's going to drive it. Plus, please continue to eat the rainbow. Your greenery is going to help you put all those nutrients in your body. Also, vitamins. You can't go wrong with a good vitamin. I even went back to old school. Dr. Shepard, you remember Geritol? I said, I went back. I
Yes.
said, let me go get you some Geritol. I remember my mom taking Geritol. I'm gonna get some liquid Geritol. So now I take a shot of Geritol every morning because I'm like, hey, they were saying it back then, so it must
They
have been
were.
working. So
There was
I
a
went
lot of
back to
stuff
the
that they
old
used
school
to
and got
do.
some liquid Geritol. You can get it on Amazon, guys. And so also just continue to live, like Dr. Shepard was saying, live. Living is important. Don't save anything. Don't say,
Mm.
oh, I'm gonna wait until this thing happen or that thing happen. No, live right now. Because you're not promised tomorrow. Look at me. I had a second diagnosis. I didn't know I was gonna have a second diagnosis, but I did. So guess what I do? If I think of something, it's already done. I'm already in New Orleans. I'm already I'll get
So
them to be gone. You'll be like, what happened? Yeah, time lost. I'm
I'm gonna
gone.
use this. I think I'm gonna have to use this because I told my husband I think I need a new car. So
Oh,
I'm gonna have to say I have to say
yeah.
I was talking to Kimberly. Kimberly said it's time.
And that's right. Dr. Shepard, go get that car. Because every time I got diagnosed, I got a new car. I got a Jag truck now. So the first one I went and got me a brand new Nissan Maxima. I love it. But now I got me a Jag truck. I feel like I deserved it.
All
So
right.
yep, that's what we driving now. But do it. Don't wait because you can't wait. You don't know if it's going to what the last day is. We only come in with one date that we know, and we don't know it, but we know it's going to be the end someday. So you want to live. You only get one life,
Yeah.
one. So that one life, you want to make sure that you're living it to its fullest. Do
Yep.
what you like to do. Do what makes you happy. Do what makes you fun. And don't say money, because
Right.
money, it's always, as long as you're healthy, you can go get it. So it's always a way to go get it. Save up for it. Do what you got to do to get it. But say that this is my penny bank. Maybe cut down that drive through because we all know you shouldn't be in that drive through anyway.
I was
So,
about to say that we need to cut the drive through anyway. We need to cut the drive through anyway. And I think with as we just sort of think about women and being healthy,
mm-hmm.
one of the things that I'm doing now is cutting the sugar.
Mm.
Added sugar, and it's not good for us on so many
On
levels.
so many levels, yes.
Cutting the sugar. And I don't like to, I mean, I do like sweets. I know Yvonne is here, but I'm not a sweet everyday person. What I was and what I started to do as I started working too much was drinking my meals. Like give me some sugar,
Mm.
this extra sweet tea thing that all of a sudden I never drank when I was younger or growing up, but then on ice, and then I wouldn't want a meal.
Yep.
Right, because that's, raising up my sugar levels or whatnot. And
Mm-hmm.
it's a way to then end up with a whole bunch of health stuff that we don't need. So
Mm-hmm.
that's what I'm very conscious of.
Yes.
Moving is important because we do feel better when we exercise. We do feel
Mm-hmm.
better when we move. And I think that's important for a survivor. It's important
Yes.
to reduce our risk of a lot of things, right?
Yes.
And so when we think about it, it's not just this is focused on cancer, but really the living a healthy lifestyle reduces diabetes risk,
Yes.
disease, all these other things. And then when you are a survivor, now you have to be just aware that some of the treatments that you've had can have long-term or latent effects, right?
Mm-hmm.
10, 15, 20 years later. So you can enjoy, you can have fun, but we want to be and we don't want to throw caution to the wind and live like we don't care. Right.
Right.
Right. We want to live like I'm enjoying now and I want to be enjoying it 5 and 10 years from now. And so
Mm-hmm.
that's where the moderation comes in. And
Yep.
just being aware what we're putting in our bodies.
That's
You
right.
but yeah, I'm gonna use that car thing later on tonight.
There you go. Hey, go get that Lexus, girl. I go get it.
Go get it, go get it, go get it.
Go get it. But the drinking your meals, that's very important. I was doing that. I recently was seeing a dietitian, and I think it is very important to see a dietitian because a lot of food causes or
Okay.
drives cancer. I cut dairy. I don't even have no dairy. I don't eat dairy. I'm also laying slacking off on the sugar also. But I think it's very important to know your levels of your blood statistics. Get your markup so that you'll know what you need to be working on and stay at level. Also, of course, those vitamins. But most important thing is to continue to move forward in life. Don't allow nothing to just keep you stagnant in life. If you feel something, go do it. Go have fun. Go to the beach. Go to the mountains. Go to another country if you want. I'm trying to go to London. Really, I'm going to go to London. But lots of things out there. Lots of plenty of opportunity. Also, just like that healthy lifestyle. You want that, not just for cancer, but for all. Just like Dr. Shepard said, that heart disease, the one of the biggest killers. I'm an insurance agent, and so cancer, heart attack, and stroke. You want to get that critical illness policy. If you have anything of any of those three things in your family, you want that critical illness policy so that if you are, hopefully not, if you are diagnosed, you want to get paid out. Because I thought about it like, wow, this is one of the reasons why I became a broker so that I could educate myself. I didn't realize how insurance could be helpful.
Okay.
So just think, two diagnoses, I could have had $60,000 if I'd have had that critical illness policy, but I didn't have it. So that's why I'm educating other people to go get it. Go get a critical illness policy. It's just a rider on your life insurance policy. If you don't have a life insurance policy, go get one in your state. Get a broker, get an agent, and look at it every year. That's right, especially the Medicare people. You want to look at how insurance could be helpful for you. Um, Also, American Cancer Society. I am a big advocate of American Cancer Society. I did my first year diagnosed. I did the walk. I'm making strides, and then I also did the gala, and I volunteered. Please get in contact. Please get involved because being around people that had what you had makes you feel so amazing. You're gonna do the same thing as them. There, you'll see people that look just like you that are going to survive, that have survived, and they're thriving. Dr. Jeff Shepard said thriving, you want to be a thriver. That's after cancer. So survive. I need to change mine from survivor to thriver because I'm a thriver now. But 5 years out, you're definitely a thriver. So we want you to be there also. And in a public market will help you go get on more healthier vegetables and fruits, and they're at discounted rates. And so check into that in your local area there. And if you can't get out, she also Dr. Shepard mentioned transportation. So American Cancer Society is good with helpful with transportation as well as you have a nurse navigator
Mhm.
at your local cancer center, and they'll assist you with getting to and from treatment. But you also have other different organizations that you can reach out to. And it looks like Dr. Shepard was the ACS researcher of 2023. Wow, look at you. I love it.
That was awesome. That was awesome. So
Yeah, you didn't even mention that. You got skim right over that. American Cancer Society kept on going, nah. I love that for you.
thank you, thank you. It was a
Yes, we need more doctors like you because research is very important. American Cancer Society is really making waves. Like you said, from my first diagnosis to my second diagnosis, I did notice different things. Also that BRCA testing is very important. You want to get that genetic testing to ensure that you don't have that BRCA gene. But yeah, we need researchers like Dr. Shepard. She's going to provide us with her contact information so that
Mhm.
we can reach out to her. If you have questions, don't bombard her with a lot of questions because that's going to go depends on what type of insurance what insurance do you have in your wallet. But yeah, I'm sure she's open for questions, and then also hit her up on social media or even email. So I'll also add that information onto the into the YouTube channel. Dr. Shepard, is there anything that you wanted to close with?
I would just say that I appreciate what you're doing. And this is why we do what we do. So we work really, really hard. But it's not just about getting grants, and I've been blessed to be funded for grants. American Cancer Society,
Hey.
National Cancer Institute's funded me. We write a lot of research papers, but that's not why we do it. We really do it because each person matters. So when one person I know got her treatment, we're going to celebrate tomorrow because she's finished and she's here, right?
Mm-hmm.
My little sister that I mentioned early on from another mother, I'm like, you going to be good, right?
Right.
And so it's what do we need to do to help you do that? And so if we have been blessed to wake up another day, right? Because as you said earlier, it's not promised and it doesn't have to be cancer, right? You can
Right.
get back her. Is how are we making the most out of what God has given us? And so one of the things that we are doing that I will mention is we are putting together a book of what we've learned over the last 20 years, because I've been very
Nice.
fortunate to have a lot of women of color in my studies, Black women, African-born women and other groups, but we're focusing on again trying to narrow and really reduce and eradicate this disparity. And so we are going to share what we've learned and take it from the research scientific article jargon and disseminate it into a why does this matter to us? And
Mm-hmm.
so we will be reaching out for survivor stories to be a part of this. We want it to be an interactive process, and right now that this project is called For Her with Love, so for health,
Ooh.
empowerment, and resilience. And it's really Yvonne just being there is going to make me get emotional. But anyway, it's going to
Mm-hmm.
it's really trying to leave a legacy for hope, and so no matter what the diagnosis, there is hope in it. And sometimes it's hard, it's not good. Um, but I believe that there is hope in every experience. And so we want to share that. And now I'm going to put Yvonne on the spot with the last thing I'll say. So um, I'm going to whisper it. I don't always do what I'm supposed to do. And so sometimes I may not always be compliant because I may work too hard and get off track. And I need to be pulled back into it. So I was blessed to have a negative mammogram. Like that's a good thing.
Yay.
And so God is faithful even sometimes when we're not
That's right.
ourselves. And so in celebration of that, Yvonne actually wrote a song. And so well,
Oh, you got a song.
we got
Oh,
a
yeah.
song.
Your band gonna sing for us?
She's not gonna sing. She's not gonna sing. She's not gonna sing. I don't think so. Mm-mm. But that song really captures the testimony of the gratefulness
Wow.
that we try our best many
Mhm.
times, and sometimes we're taking care of other people. They're having their appointments, they're doing this, and
Nice.
maybe we're not putting ourselves at the top that we should, right?
Mm-hmm.
And sometimes we learn the hard way. Sometimes we learn from other people. And so this sort of song that we're putting together a video for is very personal because it really is the blessing of his faithfulness
Love it.
when we get off track. So I whispered that, so I know no one really heard it, but I also know I'm not alone.
No.
So rather than we there's not shame when we fall off, whether it's the diet or whatever it is, but we get back on and we're thankful for the grace that he has. So now I'm done with that, and that's even.
Well, without further ado, we got Yvonne. She joined us. Hey, Yvonne.
Hello, hello. It's such an honor to be here with you today.
Thank you.
I am not going to sing. That's,
Oh, come
Okay.
on.
you don't want that. You want viewers, right?
Special viewers, yes.
But I do want to share a little bit about the song I wrote for Dr. Shepherd.
Yeah.
So I've been working with Dr. Shepherd 20 years ish
20,
now,
Wow.
20 plus.
um, and we've been through a lot of things together.
I'm sure.
And one of the things that always inspires me about her is her resilience. And that's one thing
Love
I
it.
know that a lot of our survivors are. They're very
Mhm.
resilient. And you spoke about survivors earlier. You're
Yes.
looking at one right there. That is a thriving survivor right there. So she texted me the day she got that clean report because I must admit she's been on my prayer list for a minute. So when she got that report, I felt like it was me getting the report because I just wanted her to have a good report.
Nice.
And she got it. So I was kind of joking around when I said, oh, we need a song about that. But then I went ahead and I put the song together for her. It's called One of the Ones.
One of the ones. All right.
And in this song, is a lot of the things that I've heard Dr. Shepherd say
Mm-hmm.
throughout the years about survivorship, about the faithfulness of God, and a
Mm-hmm.
few other things. So it's very, very personal to her. When I sent it to her, yeah, I thought she listened and be like, oh yeah, Yvonne, that's nice. But she listens to that song every day.
Oh,
She shouts
love
around
that.
to it. I mean, she did, and there's a part where I put a praise break in there in the song
Ooh,
for her to dance. And just thank God for his many blessings and for allowing her to do this work. Now, she has a unique perspective in that she is a seasoned, very experienced, top of the field researcher, but
yes.
she's also a woman who has been impacted by a cancer that a lot of us will.
Mm-hmm.
So she sees things from a couple of different sides. So when
Mm-hmm.
to hear her talk about it, she's not just talking about what she read or what she heard somebody say at some point.
She lived it.
She lived it. She lived it. And that is one of the things that I appreciate the most about her. So
Love that.
thank you for this interview and for allowing me to share my little story about how much I appreciate Dr. Shepherd.
Oh, thank you so much, Yvonne. I appreciate you, providing that testimony regarding Miss Dr. Shepherd. That is amazing. And Dr. Shepherd, thank you so much for being transparent. I know it's not easy to be able to, share your story and to provide information that you personally gone through, as well as not just on the educational side, but your own personal, experience. So I commend you and I thank you for that. It takes a lot of courage and guts to do that. And thank you so much that you heard it here first. So I encourage you, to be empowered and to, share that testimony. If you feel like it's going to help someone, the Lord gives us, he puts us through tests so that we can provide that testimony. And so you do it when you feel healthy and when you feel healed enough to be able to do that. And so I appreciate you, giving me a little bit to give to my viewers on Survivor's Life. I'm super excited to get it out. You guys will be the first ones to get it because I'll send it to you first.
But just very excited that you reached out, and we are embarking on something new right now.
Good.
We are embarking on something new, and so this will be I think about connections,
Mm-hmm.
and when I'm in many spaces, when we work with survivor groups or I bring survivors, I'm step back and I'm in the science mode and I let them lead that mode, right?
Mm-hmm. Mm-hmm.
That's their space. And so we want to provide a platform for more people to come together um,
Yes.
and to share. So we will probably reaching out to you
Oh.
because you are close. And there are many things that you said, honestly, about the surgery piece,
Mm.
I know are missing in patient materials.
Mm-hmm.
So I think that there'll be some opportunities. And so I'm just excited to see how God's going to put all this stuff together, as we move forward. So this was
Love it.
this was good.
Love it. It's been amazing. And thank you so much. And thank you, Yvonne, for coming, to just reaching out and just approving to come on board. Mainly because we need more people to advocate that looks like us. And because we need to have that piece to, hey, go get those clinical trials
That's right. But it's
so that we
okay.
can move forward,
Yes.
so that we can, stop this cancer from happening because we need help.
Yeah.
And just education is key. And
Mm.
this is something that we're not really actively, seeking out. So if they don't ask you, please ask them. Also, just so many things that you said, and I got lots of information, and I'll be putting those links up, and I'll be adding some information that if people may not understand what you said,
Yes.
but I'll be putting it down in layman's terms, so nobody has to be a doctor to listen to watch this survivor's life.
No, 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 no. You just gotta,
Right.
and
And
help and
so
share somebody. Yeah.
yeah, like I said, if you want to get in contact with Dr. Shepard, she'll be giving me her information. Thank you so much,
All
Mom,
right.
for thinking of us. But
Oh,
you
take
guys
care.
have yourself a wonderful rest of your evening.
All
Thank you
right.
so much for coming up to A Survivor's Life.
Thank
Peace,
you.
love, light, and happiness.
All right. Bye-bye.